Hello, I'm Jeff Gertner, the new chair of the Department of Surgery at the University of Arizona. I joined the department in January of this year, and as a newcomer, I'm excited by the many strengths of the department and the willingness to embrace new ideas as we grow. Change can be scary, but in an ever-evolving world, change is unfortunately a constant. However, when we meet change with optimism, I think change can bring the hope of a better tomorrow. I'm so grateful to have a team that so embraces that vision. The open-mindedness, intelligence, and caring of our faculty and staff will enable us to do great things together. Now I would like to briefly update you on our progress over the past year. On the clinical side, we have a new chief of the podiatry section, Dr. Alan Cole, who came to us from New York City. The cardiothoracic surgery division welcomed Stephanie Worrell, who has launched a new section of thoracic surgery and really brings unrivaled expertise in the treatment of esophageal cancer and lung lesions. The combined divisions of trauma and surgical oncology added 7 new members this year and have grown our colorectal surgery, endocrine surgery, and hepatobiliary teams. I'm proud to let you know that we are now the dominant provider of HPB services and the only HIPEC provider in Tucson. Finally, Dr. Ken Lichty has joined the department as our pediatric surgery division chief. His arrival enables us to build one of the Southwest's premier pediatric surgical specialty services, and we will build the only fetal surgery center in Arizona. As with every healthcare facility, our clinical activity has fluctuated because of COVID's impacts. In 2021, we saw a predominance of urgent and emerging cases as people sought delayed care for their conditions. However, this year we have seen a 13% increase in elective surgical procedures. Elective surgery is going to be the key to our financial viability over the next few years, and we expect continued growth in every division of the Department of Surgery. Notable accomplishments over the past year include the opening of the Division of Trauma's new burn unit, the only such facility in Tucson and South Arizona. The transplant service has more than tripled the number of living donor-related kidney transplants performed in 2022. And thanks to the efforts of Dr. Rayal, the National Pancreas Foundation named us a clinical and academic center of excellence for both pancreatic cancer and pancreatitis. These clinical successes would not be possible without the help of all the hospital staff, residents, and fellows who do so much to care for our patients. Thank you for everything you do to make sure our patients are well taken care of. Of course, training the next generation of surgeons continues to be the core mission here in Tucson. Currently, we have vibrant residency and fellowship programs in vascular surgery, trauma surgery, CT surgery, minimally invasive surgery, and general surgery. Each year, we have the privilege of welcoming in a new class of residents who are embarking on their journeys to become surgeons. I'm extremely proud of our new general surgery residency program director, Dr. Mike Datillo, and his team for successfully ushering in our most recent class. I'm also incredibly proud of our residents who have shaped our program's education, cultural competency, training, M&M, and work-based assessments. Our residents are leaders and have helped us understand how to better meet their educational needs. Along these lines, we are excited to relaunch our Cape Town, South Africa rotation in January. And we've also seen a significant spike in resident research participation. As an academic medical institution, we are in a position of influence to help shape what surgical training is going to look like in the future. It really encourages me to see our educational leaders and residents stepping up in our department to pursue changes that will make our field stronger. Finally, our translational research and surgical innovation programs continue to grow. We have a $21 million research portfolio and $8 million of new awards in 2022. This has increased our Blue Ridge ranking, which is based on NIH funding, from number 54 to 46 for the year 2021. We expect this to increase further when the 2022 rankings come out in spring. Aside from rankings, we've had a number of notable research accomplishments that I would like to briefly highlight. Vascular surgeon Dr. Craig Weinkauf has received major funding from the NIH in the form of a large R01 grant to conduct clinical trials exploring the relationship between carotid artery disease and Alzheimer's disease. The Institute for Cellular Transplantation continues to pioneer methods of transplanting islet cells to reverse diabetes without the need for immunosuppression. Led by Dr. Pappas, the ICT is developing an in situ device that would allow us to deliver stem cell-based pancreatic islet cells to patients and cure type 1 diabetes. We were able to recruit Dr. Ken Lichty's world-renowned Laboratory for Regenerative Biology from the University of Colorado. This laboratory is co-led by Associate Professor Dr. Carlos Zagreb. This group is developing groundbreaking treatments using stem cells, gene therapy, and small molecules, and has already spun off a startup company on campus. My own lab moved from Stanford with my co-director, Assistant Professor Dr. Kellen Chen, in May of this year. We have been able to get our NIDDK-supported clinical trials up and running for diabetic foot ulcers and have begun collaborations with the C2SHIP program to develop sensor-based smart electronic technology to help patients at risk of amputation for invasive infection or non-healing wounds. None of this work is supported by clinical revenues, and with declines in the availability of NIH funding, it is becoming increasingly difficult to help young surgeon scientists start their careers. If you're interested in supporting any of our research or educational programs, please reach out to me directly to discuss how you can help these young faculty members. None of these accomplishments would be possible without our administrative staff. I want you all to know how deeply grateful I am for the time and effort you put into supporting our faculty members and supporting our educational, research, and clinical programs. In closing, I am very proud of everything we've been able to accomplish this past year. However, I am sure that this is just the beginning. By working together, embracing all of our different perspectives, I know that we can creatively improve surgical practice both now and in the future. Your vision, enthusiasm, and perseverance inspire me every day. I am confident that we're on our way to an even better tomorrow.